Good morning, everyone. I hope I'm being audible. Can someone just respond to ensure that you can all hear me?
Perfect.
We can hear you. Thank you.
Good morning. We can hear you.
Good morning, everyone. Thank you so much for coming to our very, very important day, a day that is important for everyone in the world, especially during this time of very hard times with the pandemic. And of course, food safety is a very, very important thing. Actually, they say after health, the food industry is the most important during this pandemic. Okay, so today we're going to have a 1.5 hour talk, and the theme of the talk, according to WHO and FAO, is food safety, everyone's business. Okay, this is our own topic for this talk, which is no food security without food safety. And our sub-theme is no food safety, no harm. And we must actually appreciate one of our interns at FoodBev International who actually came up with this theme. No food safety, no harm. This is just our company, FoodBev International Consulting. We are based in South Africa, and we are a training and consulting organization. Just a little bit about our panelists. We are very honored today to have a team of experts. I will introduce them as they talk, but we've got Mrs. Kotsakatsande, who's actually the director of FoodBev. She will be a co-host for me. She will be my backup. She's my boss, but today she will be co-hosting this session. We also have Miss Dashita Patel from Canada. I will introduce her properly during her talk. And we've got Miss Tembi Bly from here in South Africa, in the Eastern Cape, Port Elizabeth. Then we're honored to have Dr. Edson Chifamba, who's from based in Zimbabwe. And we have Mr. Takudzwa Kufa, or Taku, we call him Taku, from the UK. And last but not least, we are honored to have Mr. Togi Chinoda. Togi is also based in Canada. This is our program for today. We will start the talk by introducing Mr. Kufa Taku, who's going to talk about COVID-19, an opportunity to create and reinforce food safety culture. His talk will be followed by Tembi's talk entitled Complexities of Food Safety Systems in Africa, Challenges and Solutions. Then we have Edson, who's going to talk about food security and role of smallholder scale dairy sector. So Edson is a dairy specialist, and he'll bring in the dairy flavor into this talk. Then from Canada, we have Dashita Patel, who's going to talk about keep it safe. Business operators must ensure food is safe. And last but not least, Togi will wrap up with a talk entitled Food Safety in the Eye of the Producer or Supplier versus the Consumer. So we have fitted all our talks in all the 5 calls to action that were outlined by WHO and FAO. At the end of this presentation, which we hope will go very quickly, we'll then have a discussion where you will all be participating And just a few house and we'll get the panelists to answer some of those questions. Without further ado, I'll call upon Taku to share his presentation. I'll share mine. Taku, are you there? We might not have Taku on the line yet. Maybe we can move on to Tembi. We can start with Tembi and then we see whether Taku will join us. Tembi, you can share your screen.
All right, Doc.
So while Tembi is sharing his screen, I'll just introduce here. So Ms. Tembi Bly is a principal environmental health practitioner at Nelson Mandela Municipality in the Eastern Cape in South Africa. She holds a degree in environmental health and an honors degree in sustainable development. Tembi has worked as an environmental health practitioner for over 14 years, assessing different food industries. She is very passionate about improving food safety standards in informal food traders to ensure compliance with South African food legislation. Tembi is well versed with food-related legislations, and although his studies include enforcing food-related legislation to ensure compliance, which can lead to prosecutions, Tembi, the informal sector, which mainly comprise of the most vulnerable people in our society, often presents these challenges, which makes her to take a developmental and educative approach to her work. Thank you very much. I will hand over to you, Tembi.
Thank you so much, Doc. Thank you so much to everyone. Hello, everybody. As Doc has already mentioned, that I work as an environmental health practitioner, which I will refer to as an EHP as I go on with my presentation. But basically, my job requires a lot of enforcement because one has to comply with the regulation, with the standards, codes of practice, and so on. But as it has already been said, because of the complexities, which is the topic that I'll get into now, we then rather take a developmental approach because it's not always, you know, what you see. There are always other underlying circumstances which then now forces one to take a different approach into doing their work. I've worked in both the formal and informal sector, you know, enforcing food safety issues. Now, when you go to my presentation, as you can see that my topic is complexities of food safety systems in Africa, challenges and solutions. So that is what we'll be, you know, looking at. Food is one thing that is common to all of us as humans. We all consume it. You know, in order to promote good health and also to ensure sustainable life. However, this notion has not always proven to be quite what it needs to be, because sometimes we consume unsafe food which may contain bacteria, viruses, parasites, and other chemical substances. And these are responsible, you know, for more than 200 diseases, which range from diarrhea to cancer. The World Health Organization estimates that almost 1 in 10 people in the world fall ill after eating contaminated food. That goes to show that there is a problem with food safety all around the world. Diarrheal diseases are common illnesses that result from consumption. You know, with us adults, we may not get sick very often, but when it comes to children, children are the most vulnerable. And we've seen cases of children, especially under the ages of 2 years old, dying from food safety issues. And besides the fact that food safety causes death and other things, but it does hammer on the socio-economic development because it puts strain on the healthcare system. The more people get ill, you know, the more overwhelmed the healthcare system becomes. It hammers the national economies, the tourism, as well as the trade. And to solve this problem, I think, you know, good collaboration between government, producers, consumers, everybody in the food safety chain should rather have this kind of discussions in order, you know, for us, all of us in the food industry to put measures in place to ensure food safety. And the theme, I'm not going to dwell too much on the theme. The theme is there, it's on the internet. All of us, we know about the theme. But I want to reiterate that, you know, food safety is everyone's business. It is, because it starts right in the beginning. And as much as we may be different professions, but all these things are intertwined. And these are the very same things that at the end of the day, you know, form or result into all of these complexities. So basically, just to highlight some of the challenges that we've had in food safety in Africa. Foodborne diseases and other food safety issues are among the developing challenges faced by African continent. The World Health Organization estimates that Africa has the highest burden of food safety diseases. And it is you know, that it is even estimated that foodborne diseases are in par with HIV, AIDS, TB, and malaria, which at some stage, TB, AIDS, and malaria were the highest in Africa. But now food safety or foodborne diseases are in par with those. The World Bank estimates its financial burden from lost human capital, treating diseases, and trade loss in 10 billion of US dollars. When we go on with the presentation, I will show you how some of these trade losses have happened, especially here in South Africa. We had one big case of a food poisoning that happened that resulted in trade loss. Women and children are the mostly at risk, especially as well as the elderly. All the groups that are immunodeficient, they are at risk of contracting foodborne illnesses. And these illnesses may be fatal to some. Just highlighting some of the consequences of unsafe food. In 2014, we had a case in Joburg where a child consumed food that was contaminated at school. And unfortunately for the family, it resulted in you know, the issue was rather fatal. The child passed on. And the second one that we've had is an issue of listeria poisoning that we had in one of our big companies, which is Tiger Brands. That listeria poisoning resulted in more than 200 deaths. And besides the fact that it resulted to the deaths, there was a loss in terms of trade, in terms of socio-economic status, because the company lost about 5.7 billion rand due to the listeriosis outbreak that happened in 2018. So food safety is really one of the main issues in all aspects of life, to protect the economy, to protect the health of the communities. So now I'm going to look at factors that affect food safety. What are the factors, especially in Africa, that are contributing to food safety issues? I've listed quite a few of them. They might not be limited to that, but what I will look at first is urbanization. Urbanization came in Africa in you know, towards the end of the 19th century. And what urbanization did, it offered hope to a lot of people because there was an industrialization that was taking place in the cities. And everybody left now the rural areas to come and stay in the cities with the hope that they would get better lives, better education, better medical care. So what urbanization did, it attracted a lot of people into the cities. So there was a high number, you know, the growing populations that happened in the cities. But the reality when the people got into the cities was not what they anticipated. When they got to the cities, there was no jobs, there was no shelter, there was no infrastructure. You know, there were a whole lot of other issues that they did not anticipate when they left the areas where they stayed. So those, that in itself forced, you know, people to look at other means of survival. And then that resulted to a lot of informal trading because people had to make means to survive. And in the areas, you know, in most of the areas that you would find clustered informal traders trading in all sorts of different food, be it meat, cooked food, and everything else. Those are the areas that in a lot of cases are not, you know, earmarked for trading zones. So they would not have any kind of any infrastructure. There's no water connection. There's no sanitation. There's no means for them, you know, that they can perform any hygiene practices. And that compromises food safety. The second issue is the issue of climate change. We've seen, as you know, the African continent faced with different kinds of challenges when it comes to issues of climate change. But the one that is main and directly linked to food safety is drought. Because what drought did, drought threatened food security. Drought threatened food safety. There's no water. And also, even we work a lot, the Eastern Cape, the municipality that I'm in, is responsible to supply, I think, about 80% of the province's milk. We've got a lot of farmers in the Eastern Cape. But what had happened in that, because of drought, we lost some of the farmers had to close down because the herds were not producing as much milk as possible. So there's issues of food security and there's no water as well. So climate change has brought about other effects of food safety, which contribute to foodborne illnesses. The growing population, you know, people are on the rush. We're working every morning. We on the run. We do not have time to make proper meals at home. So it then there's a high demand in terms of fast foods, which some of these fast foods have you know, have contributed a lot in terms of foodborne illnesses. We had one minister recently, now that there's COVID, you know, people are buying online, there's the Uber Eats and so on. We had a minister that ordered, you know, a takeaway from company, from a food outlet. And she complained about the issue, you know, the quality of food when the food got to her. Because one other thing that one has to put in mind, you know, the food is packed is transported in a container that is not suitable at times, the temperature and other things that may affect the quality of the food when it gets to the consumer. So the issue of takeaways is also, you know, contributing to foodborne illnesses. And one other thing is, because of the growing population, there's a high demand of food. And it has resulted now in more complex systems of food supply, which are sometimes, you know, compromises food safety. The fourth one is some of the international trade agreements. There are different trade agreements There's an AGOA agreement. In South Africa, to be specific, we're getting a lot of imported chicken from the US as well as Brazil. And some of these chickens, the quality of the chicken and the quality, you know, and the researchers have shown that some of this chicken may contain high level of salmonella, which is one of the agents that are, or rather bacteria that are responsible to cause foodborne illnesses. And the fifth one is food hygiene. That relates to how food is transported, how food is stored, you know, the environment where the foodstuffs are stored, which may lead to cross-contamination, which may lead to, you know, the quality of the foodstuff being compromised. So food hygiene, it relates to a lot of hygiene issues around how food is handled, how food is displayed before the consumer, you know, purchases the food, you know, the item that they need to eat at the time. Personal hygiene of food handlers is one of the issues that have contributed a lot to food safety, or rather compromised food safety. We do a lot of inspections at food outlets, and you would find people, you know, food handlers with the PPE not being adequate, if at all they have any PPE. You'd remember that lots of the food handlers, especially in the informal market, they are just people who are finding an opportunity to make an income. They do not have any understanding of food safety. They don't understand that there is a responsibility behind handling food. They know how to make food for their families, but they don't know how to make food for the masses. So a lot of them, they are just there to sell small takeaways. There's something in South Africa that we call amagwinya, bright meat, very popular, we love it, you know. And some of these foodstuffs that they're selling, they are high-risk food, such as, you know, it's processed milk, processed meat, Polonies, your Polonies, your Viennas, they use a lot of this. There are inadequate storage facilities on site. You go on site, you find this specific item, it's in a plastic container, and the entire day the plastic container is filled and sweating. And that environment is the one that allows the multiplication of bacteria. And we know that our communities, they do not have money. They don't have luxury of buying items at proper retail stores. So they end up buying from the informal trader that the polony was on site since 5 o'clock in the morning, and it was not stored correctly. They purchased it late in the day. And there's a high possibility that there was a growth of bacteria in that, or microorganisms. So those are the issues that, you know, contribute a lot, you know, in terms of food safety. There's kitchen hygiene. Kitchen hygiene basically looks at how the kitchen is organized, and how then in the kitchen environment itself, you know, the layout of the kitchen that can lead to cross-contamination. And equipment hygiene that speaks to the cleanliness, to the cleaning regime, you know, the disassembling and assembling of the equipment in the kitchen. Because if the equipment is not cleaned properly, then it can also lead to foodborne illnesses or cross-contamination. Just some of the challenges that we face a lot is infrastructure challenges. It is, you know, blocked drains, just the infrastructure is not in a good state, due to lack of knowledge sometimes, and just that the system is overloaded. Those are some of the pictures of informal trading that you would find in a lot of informal sector in South Africa. Almost all townships in South Africa do have a picture looking like that. These are some of the informal trading structures that you find in an informal sector. if you see, you know, this is what I was referring to. In those two containers, there's something that was prepared in the morning before the trader got on site, and it is gonna stay like that for the entire day. And then we get those ones, we get containers, and some of them, especially this one, you'd find that there's a certain level of compliance in terms of the surfaces. They even sometimes have electricity connection, they've got refrigerators on site, and yeah. So we're gonna now look in the legislation in South Africa. The legislation that drives food safety control in South Africa. We've got a constitution, you know, section 24 of that, it specifies that everyone has a right to an environment that is not harmful to their health and well-being. That drives us as EHPs. We need to make sure that that section is adhered to at all times. It does not mean that, it does not say people in the formal sector and people in an informal sector, but everybody, all persons have got that right. And we've got the Foodstuffs, Cosmetics and Disinfectant Act. That is the act that gives powers to the EHPs. And basically that act has a set of regulations that are promulgated under this act. So this, what these regulations set, they set standard limits for chemical analysis and bacteriological analysis. Part of what we do in ensuring food safety, we do chemical analysis, we do bacteriological analysis, and those limits are set under sets of regulations that are formed under that act. And just below that, what we have, we've got Codex Alimentarius. In South Africa, we are part of the Codex community. That is an international food safety standard, you know, codes of practice and guidelines that are relating to food safety. So anything that is not regulated by the Foodstuffs Act, then we enforce it under the Codex Alimentarius. We've got the National Health Act. It's just a framework for structure uniform health system. So it guides who does what in terms of the spheres of government. And we've got the main one, the Regulation 638, which was only promulgated in 2018. So this is the regulation that guides the hygiene of the food premises. So basically, in short, the scope of what we do is outlined in Regulation 698 of 2009. In food control, as an environmental health practitioner, we ensure that food safety in respect of acceptable microbial and chemical standards. We inspect food production, distribution, and consumption areas. We monitor informal food trading. In that monitoring, we not only monitor, we try and develop them, you know, because of the complexities that we've already spoken about. We enforce legislation and Codex Alimentarius. We apply food quality monitoring programs such as HACCP. We ensure transportation, handling, storage, and preparation of food. The promotion of safe handling of meat and meat products. We also promote safe handling of milk and milk products. So I did not dwell much under the Regulation 638, but then I've highlighted some of, I think, the most pertinent issues in that regulation. So after the outbreak of Listeria in 2018, what had happened, we then, you know, identified that there was something that was missing in the regulation. Therefore, the regulation was then amended, you know, in order to ensure food safety at all costs. So there was an amendment of Section 10 of the regulation, the duties of the person in charge of food premises. Now, what the regulation required is the training of persons in charge, because much of these issues, you know, as much as there are bigger issues like urbanization, climate change, which we cannot change over a day, but much of these issues are are due to lack of information or lack of understanding and the responsibilities of food safety. So that was then inserted in section 10 of the regulation. And also the person in charge of the premises, not only himself, but then he must make sure that even the people that he's working with in the food premises are also trained on the principles and practices of food safety and hygiene. The other issue that was amended is the issue of record keeping, of processing production. Now, food industries are required to keep records of everything that they produce. Where do they get their supply from? You know, all of that information, so that should there be a case, then it is able to trace, you know, it allows that traceability system and a recall procedure, because if we know who your supplier is, we know where do these products are coming from, how are these products stored, because now the responsibility is not only dependent on an EHP coming to a food production doing an inspection, but the person in charge of that production company must then make sure that even the suppliers of the products that they're using, he understands if I can put it that, you know, say the cradle to grave, where is it come from, how was it transported, putting all those systems in place. We call it a good manufacturing practice. Because if you get a rotten product as a producer, it is quite impossible for you to have a safe product at the end. But if you get a rotten, a safe product, raw product, then it is highly possible throughout the food production process to have a safe product at the end. So it does not only start at the production level, but the persons in charge of the production must make sure the list of suppliers, so that you are able to trace back and say, if you've got an outbreak of an illness and is traced back to your production company, you are able to look back at the system and see how or where could it have gone wrong, so that you can put measures in place to mitigate that. So in the Nelson Mandela municipality, what we have done is we have worked so well with Food Bev in training our informal traders on food safety. We want to ensure that before we can enforce, before we can bring upon legislation, you know, we understand that communities need to make money, and most of our traders are women. You know, they need survival of their families. It is not our intention to close them down. However, we do not want to compromise food safety. Therefore, we ensure it by making sure that we give them training in order for them to understand the practices of food safety. We've done a lot of food safety police operations. What we do from time to time, we visit these food outlets, especially the formal ones, or rather informal ones, the house shops in the locations, because there's a formal, there's formal in the locations, where, you know, you go and quickly buy that item. Because the food safety police were brought upon by a number of complaints in that sector, where people are being sold expired foodstuffs, and when they go back to demand refunds, and it was not given to them. So we had to take an approach to that. And I must say that those food safety police have yielded quite a positive outcome in terms of improving our food safety system. And what we have done in the Nelson Mandela municipality, we have partnered with different spheres of government. We've got the university, the Nelson Mandela University. We've also partnered with the university, businesses, and the private sector, where we have discourses on food safety and how we can then form these partnerships in order to ensure that as a collective, we improve food safety in the metro. We also do have a food safety food control committee forum, which sits, however, we have not set due to COVID, which sits every month. So the forum looks at, we're discussing, it's where different professions in the food safety industry or food control industry come together, discuss legislation, the new developments in the food safety sector, in the food control sector. So those are some of the strategies that we've put in place in order to ensure that we do improve our food safety as the municipality. So these are the 5 keys to safer food, where the World Health Organization brought these keys in 1991. These are just basic keys to safer food. It was then, established that there was a need for something simpler, something that everybody can do at home in an environment where you work in your food production company. So it is said that if we do practice all these keys to safer food, to a certain extent, we will achieve food safety. We need to keep clean through washing of hands, because we know that hands touch everywhere and hands can lead to cross-contamination. And separating of raw and cooked food products, how you store your food stuffs, and cooking thoroughly, keeping food at safe temperatures. That is very important, especially at display, especially for cooked foodstuffs that is not going to be cooked again. And the use of water and raw materials, use of safe water and raw materials, in that we rather use pasteurized milk instead of raw milk. So in conclusion, as much as it is complex to achieve food safety in Africa, I do not think it's not possible. It is possible. We just need to make sure that this partnership between governments, academic institutions, the private sector, and just generally different professions in the food industry, work together in order to achieve a sustainable food safety system. And that food safety is everyone's business. Thank you so much. Thank you.
Thank you very much, Tembi. Thank you for this insightful presentation. I think let's quickly move on to the next presenter. You can actually write your questions on the chat and we can discuss at the end. Okay, I now call upon Mr. Kufa, Takuzwa Kufa, or Taku. Taku holds an MSc Food Economics and Marketing from the University of Reading. Taku is a food technical professional with over 15 years food science technical skills and commercial experience in food manufacturing for global food brands, retail, wholesale, and food service in the United Kingdom. He is passionate about food science technology, and his profound passion has made him a thought leader in the field of food safety. And I can attest to that one. Taku is a real thought leader in this industry. Taku sits on several boards as both non-executive director, executive director with experience in privately owned companies in the UK and in Africa, with focus on business growth and helping food companies to develop growth mindsets, gain international exposure, and develop innovative strategies, business continuity, and particularly during this COVID pandemic. I will hand over to Taku to do his presentation. Over to you, Taku.
Thank you.
You can share your presentation.
I'm trying to start the video. If you could enable it on your side.
Yeah, just share your presentation on the green button. Yes.
Is it coming through?
Yeah, it's coming through.
Trying.
Excellent. We got it.
Okay.
Yeah, I think it's coming through.
Good morning, everybody. My name is Takuzwa. So sorry. I think I'm on mute. Can you hear me?
Yes, we can hear you, Taku, loud and clear.
Oh, okay. Yeah.
We can hear you loud and clear.
Yeah, thank you very much, Charles, for the introductions. We will just move on straight into my topic. It's gonna be a little bit tardy because I've been a little bit in a rush, but I think the message will be, I'll try by all means to paint the message in a more logical manner than how. So my topic today is about food safety, COVID-19. Within the context of COVID-19, I think there is an opportunity for us as Africa to seize the moment with all the focus in COVID-19, and changes to actually step change food safety within Africa. Hello?
Yes.
Yeah, so essentially I will outline the purpose of the presentation and highlight a few bits of challenges that COVID-19, different issues of COVID-19 presenting into the food, for the food business and the food supply chain, as well as the actions that we should be taking. Within that broader discussion, I will highlight contextual issues. So really the purpose of my presentation this morning is I'm trying to highlight the challenges of COVID, within the food safety challenges within the context of COVID, and making a call that we need to adopt HACCP, and that call that we need to reform food safety control systems. And I'll propose a plan for action and present a case for a food safety culture transformation. So let me get into the context. So COVID-19 is not a food safety issue per se, but it presents challenges, indirect food safety impact on both an indirect food safety impact on both packaging and the food itself. And it does present challenges on quality, legality, and authenticity of food within the supply chain through the disruptions of the health measures that are being implemented. So these are some of the public health responses that have come in with the COVID-19. We have seen a lot of international health regulations being changed, so social distancing, restrictions to operations, enforced closures, and all these restrictions to trade in PPE. There's quite a lot of restrictions to sell in biocides, biocidal chemicals that are used for cleaning materials. Countries are now reserving for themselves. So it creates a lot of challenges for the food industry in terms of access to cleaning material, access to raw materials, and that disruption in the food supply chain creates conditions that can allow food safety hazards to manifest themselves into major contamination incidences or food poisoning. So really, COVID-19 is more a food security issue for us in Africa and globally. We are in the food. I would start by explaining a little bit what food security is. It is that access, physical access to sufficient, safe, nutritious foods to meet our daily active needs for a healthy life. So really, the key word coming out of here is safe food. If it is not safe, it is not food. So any disruption to the critical infrastructure, which is the supply chain, will have an impact on the safety of the food. So within the supply chain, I'll present some of these issues around. We have seen availability of staff. We may not have enough staff to work in our factories because others are in quarantine, others have been on forced exclusions out of the food sites. The meat industry has suffered that quite a lot. A number of employees in the meat industries globally have been excluded because of outbreaks within those facilities, restrictions to operations, lockdowns. We have seen raw material availability becoming a challenge. Where the raw material is available, it could be delays in lead times and costs, all these supply interruptions. A supplier previously was supplying a particular product, they've had to change to prioritize who pays better, and you may have interruptions, emergency supplies. We have to resort to some other emergency suppliers who you may not have all the records, all the trust or all the due diligence. So there are storage challenges. Other sites have been closed and there's food rotting in those sites. When things get reopened after the lockdowns, there's that imminent risk of food safety. So hence businesses needs to be quite aware of these issues. As well as another issue, a risk factor is the stopping of audits. There's been significant. Hello?
Yes, so we can hear you.
Okay, something is happening on my screen. Yeah, sorry about that. There is that I didn't know my screen was now sharing. I thought I was alone. So there's significant stoppage that has happened on compliance audits. A number of food safety audits have been cancelled. A lot of sites are not allowing audits, so there is no that due diligence and compliance enforcement activity happening unless it is legally mandated by either health officers. That's generally across the globe, as well as availability of PPE. So really, COVID is affecting all the 4 dimensions of food safety, which is the availability, the access, how people utilize, and the stability of on the market of people having stable source of food. As food businesses, our job is to feed the nation. We are feeding nations, and this we have got to take into consideration these issues in our management, day-to-day management decisions and policy making. So just to go a little bit into the disruptions, you see, as COVID-19 came on, we had significant challenges initially of measures. There were quite a number of measures that would put crisis management measures were implemented, and most of these measures, if you dissect them, a lot of them, some of them complement, but significant number of them put our existing food controls at risk. Although the health and safety is the major priority, we now have to do some emergency purchases which come with risk to food fraud, new allergens, or other contaminants that we didn't know. So maintaining that agility and focus on those areas will protect the food supply chain and protect our businesses. Social distancing within the workplace. So sometimes that social distance come in the way of food handling, our normal safe food handling. So you've got to consider your food handling procedures in light of the social distancing, redesigning your workspaces and hygiene controls, changes in your working environment, increased hand washing. With the increase in hand washing, different businesses, some of the sites will now have we'll run out of chemicals, or availability of cleaning chemicals is an area that we all need to be looking at. That's from a very operational, looking at our segregation within our sites, the times we open, staggering break times, and all those controls that have got to do with infection control. But staff engagement and training remains quite a huge priority. It's something not to be overlooked. So that's what we have been doing. And now we are in the new phase of unlocking down the lockdowns. So it's a new era. We are in an era of volatile, complex, the uncertain, complex, and ambiguous environment. So normally we refer this to a VUCA world. So a VUCA world, to react in a VUCA world, we need risk assessments that are really robust and keeping up to date with our risk. They evolve at a pace. Sorry about my typo there. I was thinking about peace. They evolve at a pace, and we need to update our HACCPs, our risk assessment, and to remain agile and very adaptive. Have our business continuity plans in place. Our COVID policy is robust enough. Site operational controls that we enforce and verify through our internal audits and at site level. And we have raw material contingency planning, who are the next raw material, rather to have active plans in place rather than the reactive planning. We need to have food fraud vulnerability plans that are robust. In these times of crisis, thieves, criminals find an opportunity. There is an opportunity of trading food that was condemned before. It was condemned before, it was in warehouses. Now there's huge shortages, disruptions. People just want to get hold of the next food, next batch, next consignment. It's easy to get a consignment that was previously condemned for salmonella. It could be a grain. We're seeing quite significant amount of spices with salmonella being traded. We see a lot of aflatoxin, some batches of grain and cereals that would have previously been condemned for aflatoxin coming back onto the market. So shortages of chemicals is quite significant risk. I'm repeating that, but we may need to innovate ourselves out of this COVID. So in terms of our response, we need to have innovative solutions, follow government advice, and make sure that the managing perception of the people who work in the industry, especially on our shop floors, that things are in control. And that is the way that is starting to develop a culture, a robust culture within the context of crisis management. Am I still there? Sorry.
Yes, loud and clear.
Yes,
Loud and clear. Okay, something is happening to my phone. Sorry about that. So moving into the new normal, going forward, I think agility in the way we manage food safety is critical. We need to be agile during a VUCA world, in a VUCA environment. So health and safety, I'll reinforce, remains priority. Food safety risk assessment. There will be significant trade restrictions, and we need to manage those trade restrictions. We need to build resilience. So we are now moving from continuity from risk, emergency response to long-term resilient plans. It will be a new world, and we need to reflect on our resilience plans and to be robust. I will re-emphasize There's so much risk of counterfeit. There's quite significant counterfeit PPE on the market, so it's something to look out for. Sorry. We need to be prepared to respond to food law reform. Many governments are looking at reforming. Within business, how we need to sit down and ask ourselves, how are we going to innovate ourselves out of this corona crisis? So then again, I'll talk a little bit later about developing a food safety culture. But we need to put culture into the mix, the culture of food safety and quality. So really, there will be a bigger role for risk assessment and risk-based food safety management systems. Lucky in the food industry, we have already been using food safety management systems, and they have been really, and the thinking around food safety risk-based thinking around food safety management system has helped food industry to cope with the COVID-19 better than most industries. It has not been that catastrophic in terms of meeting our responsibility to feed the nations. Most countries, food has not been difficult for the food industry. I think it has done very well, thanks to the systems, the risk-based thinking in the food industry. And FAO has done a very good, in WHO have done a very good job in terms of providing guidance, and governments are providing guidance to the food industry to help us manage the crisis. And one exciting guidance is the COVID-19 food safety guidance for food businesses. It really puts the emphasis on using HACCP-based food safety systems. But what is HACCP itself? I look at HACCP as a plan to make safe food, that every business must develop its own HACCP-specific plan, must document, must demonstrate that they are using the plan and using it day in, day out in making safe food. They must have a food safety team to manage food safety within their premises, and we need to simplify HACCP so that it has got better uptake, and we need to build a new food safety culture to sustain HACCP, to sustain working of these plans. So simplifying HACCP, it's a plan to make safe food, and I think it needs to be a legal requirement in Africa. In most African countries, HACCP is not a legal requirement. So I will talk about a little bit of the contextual issues again in terms of Africa's unique challenge with regards to adoption of HACCP. So essentially, WHO, FAO, they are saying for us to survive, they've given us a guidance that we need to implement HACCP. And what are our unique challenges in Africa? It's not yet a legal requirement. It's been there since the 1960s. It's been there since the 1960s, but we have not implemented the HACCP and made it into our own laws. We have attended all the codex. We have been attending codex meetings, left, right, and center. We come back, we fly, but we have not done much in terms of advancing HACCP. Another big challenge is we've got unregulated food markets. We have got a number of missing pieces of the food safety puzzle. So, and as well as I will outline the food safety puzzle. Culture is part of the missing puzzle. both at organizational level and at national levels, at national government levels, culture is missing, the food safety culture is missing. And COVID-19, I think it presents us with that opportunity to stop and think and say, what should we do? There's been a lot of focus on hygiene, public health, so food safety is getting focus as well. So what's the plan? I think we need to start looking at food safety through the cultural perspective, not just training as a training issue. We need to regulate formal markets, get all of them registered. We now have got mobile phones. Each and every trader has got a mobile phone. We can deliver training to them through mobile applications. We can have every food vendor stop thinking about them as food vendors, as informal markets, but think about them as food handlers. They are quite key to provision of food to the population. They are quite a critical infrastructure for food safety or for food security. Regulators need reforming the law. South Africans have taken a lead with R 3638. Hello.
Yes, we are with you, Taco.
Okay, yeah.
Yeah, we're just running out of time a little.
Okay, we need to reframe food safety from being a scientist agenda to something that is a corporate governance and an ethics agenda. Most of our businesses think it's something for the quality manager. We need to take it to the boardroom, as well as businesses need strategic plans for building food safety. Sorry. So I've tried to put a diagram by Carol Wallace here, which puts where culture sits and where at national level, and I think I will share the slides, but really I'm saying culture needs to come into the mix together with our HACCP and the regulations. Yeah. So what has culture got to do with it? It's critical to sustaining standards, systems, processes, controls. So in terms of, I've highlighted culture is a missing puzzle. There are other missing puzzles to food safety in Africa. The leadership, commitment, processes, organizational structures, but culture is quite significant. So food safety culture, what is food safety culture? It encompasses our beliefs. It encompasses what we do when no one is watching. It's about our learned behaviors as a group of people. So it could be at national level, at organizational level. So GFSI talks about the Global Food Safety Initiative. It talks about culture as something that affects, that is shared values, beliefs, and norms that affect our mindsets and how we behave towards food safety. The GFSI has defined cultural dimensions. There are so many dimensions to culture in terms of when you want to develop culture. There is, if you could look at the publication of, I will not go, they defined 5 dimensions of culture, which is the vision and mission, people, adaptability, consistency, hazard awareness, hazard and risk awareness. So if you could take time and read about the GFSI food safety culture dimensions. So as a business, as businesses, as organizations, we need to build the food safety culture dimensions within our businesses. So how do you do that? at site level. I'll go back to, I've got a model. My view about HACCP is that HACCP is a plan to make safe food. Every business must prepare it, plan for it, build it, use it, prove it, and improve it. So I've put a HACCP application for process through which we can prepare to implement HACCP plan and consider the cultural issues as we are putting our HACCP plan so that it becomes sustainable. So I will not talk through about it, but HACCP, we need to prepare for it. So the preparation of HACCP needs in preparing the organization to implement HACCP involves understanding the journey for that we will take, have leaders prepared, as well as the cultural issues addressed. So within that broader adoption of HACCP, we need to lead a food safety cultural transformation. So there are a lot of food safety culture frameworks. Some of them are diagnostic frameworks, which diagnose the nature of food safety culture within your business. So others diagnose the maturity of your food safety culture. And there are other frameworks, which are structured frameworks that help you to develop a plan or implement a cultural transformation. We need to look at these. GFSI has got a food safety diagnostic tool and a maturity framework. If you can have a look at those, you will see how you can use them in leading a transformation within your business. But any business has got a culture at any stage. It could be positive, it could be negative, but there is already an existing culture, but you can transform it to an excellent food safety culture, which can be measured on a particular framework, diagnostic framework. Yeah. So how do we develop food safety culture in a business? Where do we start? I advise people to have used the ABC model for behavior change to start by looking at antecedents, behaviors, and consequences. So the antecedents are those things that we implement in our business to be able to develop food safety culture. That things that have to be there before we develop food safety, before culture takes root. And behavior is anything that individuals do and the things that are observable. So as part of the plan for action, I think as most African businesses in the journey to food safety culture, they are still right at the start. So we need to start by building the antecedents. So I've put this antecedent toolbox. You can find them in a publication by Bertrand Imon. The Bertrand Imon at Camden BRI in the UK, they produced a paper which is about how to build using the ABC model. And I find the approach of using the ABC model the best model for small businesses or businesses which are right at the start of the journey to improving food safety. Yeah. So with that, my time is up. In the interest of time, I will stop at that level. That I'll put in a call for us. Let's invest in these antecedents that allows us to start the journey to improving food safety culture.
Thank you very much, Taku, for that very, very insightful presentation. And I think you close it on a high note with a buzzword there that we can all look up: antecedents. Without further ado, we are really out of time and we really want to apologize, and we might slightly run over. But I think the information is very, very useful, and the next talks are going to be very insightful. Our next presenter is Dr. Edson Chifamba, who holds an MSc in Food Biotechnology, MBA, and PhD in Dairy Feed Technology. Edson has more than 20 years experience in the dairy production industry, processing, and overall dairy value chain. I won't read everything about his bio, but just to say that Edson has worked for UNDP in the dairy processing plants in Europe, Kenya, Burkina Faso, Tanzania, Uganda, Rwanda, Zimbabwe, Burundi, Zambia, Mozambique, and South Africa. So we are really, really honored to have Dr. Edson to share his views on the dairy sector. Thank you. Edson.
Thanks very much, Charles. Let me try and share my presentation.
We'll try to keep this as short as possible. The next presentations, they are probably just going to be about, 5 to max 10 minutes so that we catch up with time.
All right, thanks very much. Can you see my screen now?
Yes, thank you. We can see it.
So I'm going to talk about the dairy sector, the food security and the role of the smaller dairy sector, and particularly in Zimbabwe where I'm working. I'm working for the EU now, and I'm mandated to transform the Zimbabwe dairy sector, especially the small-scale dairy sector. So if I will look at, I'll start by looking at taking you through some of the background of the Zimbabwe dairy sector. So you can see in the dairy sector in Zimbabwe, we used to produce as far as 460 million liters in the 90s. Then our production went down to as low as 37 million liters in 2009. And now we're slowly peaking. Last year, of over 400 million liters. So we need now, my mandate, our mandate is a project. Hello?
Yes, we can hear you now. And can you just put your presentation on presentation mode as well, if you can?
Presentation mode.
Yeah, at the bottom of the screen, there's a button for presentation, but it's okay. We can carry on like that. It's fine.
Let me try that. So then, in terms of the split of who does what in the dairy sector, you find that large-scale commercial farmers are contributing over 75% of milk production, whereas our small guys, the old resettlement, peri-urban, A1, A2 farmers, communal, are contributing the 25%. But you find this milk does not actually always end with the processors. Normally, it's inside marketed. It doesn't end up in the processing sector. So, I want to see a way of harmonizing and also formalizing this milk to also be part of, so that at least the smallholder also contribute to cow numbers. Again, our cow numbers have gone a lot down. We are sitting at 38,000 dairy animals in the country. We need a minimum of 50,000 for us to meet our demand. So there's actually a big gap and a big challenge for us. If you look at the split of the animals in terms of per sector, you can see that most of our animals are with the large-scale commercial farmers, and also they got the largest milk production. A lot of our small-scale farmers have the indigenous animals, which, as we know, they are not very highly productive. They are also the calving persistence, the calving rates are also on the low side. So for the small-scale sector to be transformed and also to contribute more in the dairy sector, we need to do a lot to make sure that they contribute to food security in Zimbabwe. So some of the challenges that we have in the sector, in the dairy sector, include the low numbers of the farmers. We have only 530 small-scale dairy farmers in the country. There's also very poor breeds, low calving rates. Milk transportation is a challenge. Capita consumption currently in the country is sitting at 7.5 liters per person per year. And you know, WHO recommends that the per capita consumption should be 200 liters per year per person. So we have a long way to go before we can actually achieve that. But that's why we are trying to make sure that we do things that we improve milk production. So the key challenges that we are facing, farmers are using as much as 84 to 87 US dollars per cow per year, just on compliance issues. There's then also on dairy value chain linkages. There's also affecting the contribution of the small sector. So what actions can we do as a country to make sure that food security is increased? Is to make sure that we organize the sector properly so that there's actually coordination. Right now, there's that disjoint and disharmony between the processors, the government, suppliers, and also commercial farmers. So through a lot of interventions, we want to make sure that the sector acts in harmony so that everyone is a win-win situation, and our small-scale dairy sector can also start contributing to food security. So we also believe that there need to be that deliberate graduation model. As small-scale farmers have been small and have been perpetually small for years. So we want them to graduate through different interventions, through different models, so that they graduate to become medium-scale, small-scale commercial, and eventually become large-scale commercial farmers where they've just graduating the farmers. We are also trying to graduate. We are also going to graduate our milk collection centers so that at least our centers don't just remain perpetually bulking centers, but they are graduated into hubs, dairy hubs, where there's a lot of business development services around them. It could be transport, it could be extension, it could be AI, so that at least that center is not just a milk collection center, but it's a hub consisting of various BDS services, which makes it more sustainable in future. Crucial role and in food security, in poverty alleviation, and also to reduce the current protein energy malnutrition in the country, because we find that milk is the most wholesome product with the balance of all the nutrients. Currently, we have high levels of protein energy malnutrition, especially in the rural Zimbabwe, because people are not consuming milk. Like I mentioned that per capita consumption of milk is only 7 liters compared to a requirement of 200 liters per year per person. So the strength is that the smallholder sector are the producers and also the consumer. The more they produce, the more they consume. So then it results in more consumption of milk, and as a result, there's more security and food security in the country. Of course, it's very 96. The milk. Hello.
Okay, yeah, carry on. I think there's a bit of a connectivity issue, but let's just rush with it.
So the major opportunities also is that we have a lot of developmental projects, like the one that I work for, that can actually assist small-scale dairy farmers to actually attain their goals. So what are the things that we think we need to do so that the sector's contribution to food security is enhanced? Well, livestock addition is one of the things. We need to good breeds for our farmers to then contribute to the sector. The project that I work for, we are trying to we are giving heifers to small-scale farmers on a buy one get one for free. So a small farmer, when they buy one heifer, they are able to then get one for free from the project, so that at least they also contribute to food security in the country. So in this case, we are trying to make sure that the farmer numbers, the small-scale farmer numbers, increase from 430 to over 4,500 by 2022. That at least also contributed. Also, acquisition of productive assets. Farmers find it very difficult to buy assets to do with dairy, so they need to be assisted so that at least they get there, they get to those levels. Also, reduced of cost feed. Like I said, cost of production is 76% of the production cost. We need to reduce that significantly to below 50% of the production cost, so that at least milk becomes available at a cheaper source. Also, again, per capita consumption, we need to educate people and also make sure that we have those school milk programs, milk bars, to ensure that milk is actually consumed. But the only way we can do that is to ensure that the milk price is right. Which means the cost of production needs to be brought down. We also look at green technology as a sustainability issue. We are saying if people can use electricity from solar, then it's more sustainable. We have a lot of challenges in Zimbabwe right now in terms of fuel and energy. So green technology is probably a way that can sustain technology. It's a sustainable technology for a small scale farmer to also contribute to food security in the country. We're also getting out a lot of exhaustive trainings. We're also doing a lot of bulk purchases and bulk transportation of feed to ensure that the small sector to the sector. And we believe the COVID-19 has also hit us quite hard because now the cost of accessibility to feed and also the cost is skyrocketed. It's very expensive. It's also very scarce. And also now processors, because now the banks are closed, a lot of people are now doing a lot of side marketing. So the processors are affected because to their processing plants because people are finding it difficult to send milk and then not get the paycheck. So they are side marketing. And then there's also reduced in consumption. So also feed processors are finding it difficult to keep on producing low shelf life products because no one is buying them. So they are now trying to do a lot of long shelf life products. And also poor milk transportation is also one of the challenges. So that's in a nutshell what the situation is and how we believe we can actually graduate this small scale and contribute more towards food security. Thank you very much.
Thank you very much, Edson. Yes, we do have challenges, and we definitely need to overcome. Good to be talking about it and sharing. Our next speaker, I'll move on quickly, is Miss Dashita Patel, all the way from Canada. Dashita holds a BSc degree from the University of Bridgeport. She completed a number of professional training and certification programs, including HACCP, HAPSI, the American version, GFSI, Internal Audits Allegiance, Lean Six Sigma, and a number of others. Dashita has 15 years experience working as a food safety and quality manager. I'll hand over to Dashita.
Hello, everyone. Charles, can you hear me?
Yes, we can hear you. Maybe Edson, you can just stop sharing your screen. Thank you.
Yeah, I've stopped. Yeah.
Hello, everyone. My name is Darshita Patel, and I am a senior food safety and quality manager at Sanapta. I oversee departments such as research and development, quality, HACCP, GFSI audit, supply chain, and FISMA for all our plants. Last year, 2 of our SKF facilities achieved 100% score, and we are proud of it. So I will be talking about business operators must make sure the food is safe. Any food handling business, whether it is importing, exporting, manufacturing, packaging, storage, or transportation, anyone who comes in close contact with the food products, such as suppliers and service providers, their first and most important responsibility is to ensure that food is safe for us, the consumers. I would like to take this opportunity to thank all those workers and their families who have put their life at risk in this crisis and continue working in the food companies to provide safe and healthy food for all people throughout the world. I would like to share what we have implemented, some of the important procedures to prevent spread of COVID-19. And at the same time, our objective is to ensure that food safety is not compromised. Just a few high-level procedures I would like to highlight are physical distance throughout the plant and in the offices. There are signs posted on the floor, continuous reminder to the employees that they need to make sure they are 6 feet distance, working from home, meeting over the phone or online, and use of equipments and tools sharing between employees is minimized, including pen, clipboards, and knives. Training of employees is very important as well, and that is one of the challenge that each and every food facilities are facing currently. If you have any temporary employees, make sure there is proper training provided to the employees because they are not aware about food safety procedures and prerequisite programs. Monitoring employees' practices in following physical distances and illnesses. We have implemented daily employee body temperature is monitored. Daily employees are required to complete pre-screening questionnaire. Employee practices are monitored physical distancing, segregated shifts, and breaks. We have also created a movement employee map identifying restricted food traffic. At this point, we do not have any visitor policy and only essential service providers are allowed. However, they are screened at each visit. We have also increased cleaning and sanitation frequencies in several areas, such as employees' areas, lunchroom, washroom, change room. Frequently touch objects, such as including doorknobs, light switches, handrails, touch screen, and keypads. And staff are trained in cleaning sanitary procedures. It is very important that cleaning is done effectively, and thus we will make sure that the food is produced safe. Additionally, we have added daily operational checks to ensure that all the employees are following GMPs. We have also approved additional essential suppliers and service providers for business continuity. We are SQF certified facilities. Each supplier and service provider must be approved as per the program. The purchasing, production, and QA department works together to ensure that enough food quality materials are used for each lot of our products. Not only raw materials, we have also approved suppliers for packaging and labeling materials, PPE such as face masks, gloves, cleaning chemicals, and hand washing. Thorough inspections of incoming materials to prevent any food fraud. We are also monitoring closely food fraud website on daily basis as the number of food fraud cases are increased up to 30% since COVID-19 started. Daily management meetings are scheduled, and we do discuss daily about COVID-19 updates, food safety and quality objectives, any corrective action reports, customer complaints, and internal audits. Record keeping. I just want to highlight over here with the record keeping, everything you do must be recorded. If you can't show the records, it means it would never happen. Last, I want to highlight the resources that we are using here are Ministry of Health, Canadian Food Inspection Agency, World Health Organization, Center of Disease. I really appreciate everyone's participate in this event as it shows that we all are sharing the same dedication of supplying safe food to all our consumers. Thank you very much.
Thank you so much, Dashita. Yeah, we have actually caught up with time. And just to highlight that we did not request Dashita and Morgan to do PowerPoint presentations because we were trying to manage our time. So I'll quickly now introduce our last speaker, Morgan or Togi Chinoda, as we passionately call him, Togi. Togi has worked for Coca-Cola for the past 25 or more years, and he holds a master's degree and bachelor's degree in mechanical engineering from Tennessee University in the USA. And he worked in technical services, manufacturing strategy, and business development and general management roles in several markets, including Central Africa, USA, Canada, and South Africa as well. I hand over to Togi.
Sound check. Good morning, or good afternoon, or good evening, wherever you are. Can you hear me?
Yes, we can, loud and clear.
Thank you. Yes, my name is Togi Chinoda, as I'm affectionately known. Right now, I'm now the senior engineering manager for Coca-Cola here in Canada. I must say that we've had very exciting and very thought-provoking topics. Very encouraging to hear all these people, knowledge people talk about it. What is food safety? Food safety is the unintentional contamination of food that you take in and it damages your health. So as such, as manufacturers or as it moves or preparations of food, we have to eliminate all the risks or eliminate all those unintentional contamination of food. Now, let me ask you a question. How many of you have signed a contract to have a friend? It's a big no. There's no contract. However, there's a mutual understanding. There's a mutual trust that exists between friendship. When that sends out a contract which is silent. However, now we turn that to the business and food safety. Between the supplier or the manufacturer as well as the consumer, there's a silent contract that you have to adhere to. What is that? It's really the mutual trust between the supplier. When you go to the shop or wherever you're buying food, you're saying, I trust that the food that has been prepared is safe for my consumption, right? So that's a contract that you have signed. That's a contract between you as the consumer and the manufacturer. So you have to honor those, both parties have to honor those contracts. As a manufacturer, you have to make sure that you alleviate or you eliminate those risks. The intentional contamination of the food, you have to do that. There are tools out there. All my colleagues have spoken about them. You have to implement HACCP, right, which is acronym for Hazard Analysis and Critical Control Point. You have to do that. There is a 7-point level that you have to do, procedure that you have to do to be certified. One of my colleagues touched on that. You have to follow GMP, good manufacturing practices, right? There's the global food safety initiative out there. They've got standards. You have to follow those standards. Companies do internal and external audits. Manufacturers, producers, they have to call in people, external people, third-party people to come in and audit and certify that your plant or your processes are in line with the global food standards. Manufacturers are spending a lot of money, billions of money, just to make sure that they honor that contract that they have signed or they assume to have signed with you as the consumer. So that's the part of the producer or the manufacturer. How about us as the consumers, right? What do we have to do? We have to make sure that the food that we take into our bodies is healthy, it's safe. We can't just leave it to the manufacturer. Once the food is left in manufacturer's hands or the facility, there's no more control over there. So us as consumers, we follow what I would call the 3 C's and 1 F. Somebody touched on that, right? The first C would be clean, right? You have to clean, or we have to clean the food that we intake. We have to clean the surfaces you know, with the cutting boards or the pots, all the surfaces that handle food, you have to clean those. Fruits that you cannot cook, you have to rinse them. You gotta rinse them. The S that we talk about, food has to be separated. Fruits have to be separated from meat, right? There's frozen food, there is chilled food, there is just raw food. You have to make sure that it's separated. The second C is about cooking the food. Every manufacturer will give you either menus or will give you directions on how to cook. Fish is cooked at a different temperature than meat, red meat. Vegetables are cooked at a different temperature, so you have to cook the food in a recommended temperature that are supplied. The third C is chill. You have to chill the food. Practice the 2-hour rule. If you buy a chilled food from a supermarket or from a store, make sure that you put it back into if you're not going to consume it immediately, make sure that you have put it in the fridge for within the 2 hours. When you are storing frozen food, do not store food in open air. Store food underwater, running water or underwater, or in the fridge. Somebody mentioned about frying or mentioned about barbecuing. Here we call it barbecuing, right? When you marinate that food, make sure that you marinate that food and put it back into the fridge. So that covers what we have to do as manufacturers. We have to implement assets. We have to implement good manufacturing practices. And then as consumers of stuff, we gotta practice the 3 C's and 1 S. And those are the contracts that I call that you have to find between each other. There are a lot of details that we have to look up to. So the question is, what are those details as a supplier or as a consumer that we need to look at? What are those items? Okay. It's safe. That's the topic. All consumers have a right to a safe food, health food, and a nutritious food. Thank you.
Thank you so much, Togi. I really like the angle that consumers will have a role to play. Without further ado, let me just put this to the audience or to the questions. We have overshot our time, but I think the subject is very, very interesting, and we can just hang on for another maybe 5-10 minutes if we can, and just go through the questions. I've got a couple of questions here. I'll start with one from Justice. Justice asks, which foodborne diseases are more prevalent in Africa, if such data is available? I can just ask any of the panelists, including Kotsa, to take that. Which foodborne diseases are most prevalent in Africa?
Yeah, perhaps I can take that. The major foodborne pathogens in Africa perhaps could be Salmonella, could be E. coli, especially the challenge perhaps in the meat industry. It's E. coli 0157. Obviously, and Staphylococcus, that's very common because that is a pathogen that is on our bodies, in the nose, in the eyes, in the ears, also on the mouth. To know about whether there's any information on that, I'm not really sure, but in terms of prevalence and common knowledge, I think that's what is mainly common, Salmonella E. coli 157 and Staphylococcus. Of course, there are other pathogens like your Bacillus cereus and so forth.
Yes, thank you. And remember, we also had a big outbreak of listeria in South Africa that claimed about 216 lives in the last year. So those are some of the challenges that we do have. Okay, I've got another. It's a comment from Prof. Katerere that says, I think he was also talking about the insidious threats of aflatoxins. So in Africa, I think aflatoxins is a major problem, especially in West Africa and East and Central Africa. So thank you for that comment, Prof. I got another one. I think it was articulated on the chart regarding the slow adoption of HACCP. Probably, Taku, you might want to just articulate to that. There's a question whether this is an industry problem, or is a government regulatory problem, or is both? Maybe Taku can take that one. If you are there, Taku, you might want to unmute. Okay, we don't seem to be having Taku on the line. Who wants to take that? Maybe Morgan, do you want to take that one in terms of the uptake of HACCP?
Okay, so I'll take from my discussion. I mentioned that the responsibility really has to be spearheaded by the industry. It has to be in the, you have that trust. And you also, as an industry or as a company, you do need to promote yourself. As such, food quality and food safety is important. So initially, I would say that it has to be done through the industry. Once everybody is now happy, yeah, we will have to get the regulatories, of course, through the ministries, as my earlier colleague said earlier, that there is the Ministry of Health, there's the Ministry of Agriculture within all the countries. Their role is just to enforce. It's not to put together the implementation of HACCP. The HACCP implementation lies with us as an industry.
Yes, thank you, Togi. I think the core regulatory approach, the industry, government cannot see everyone, so industry needs to take responsibility. But more so, I like your contribution, Togi, on the contracts. Consumers need to demand, through the Consumer Protection Acts, and we need to put pressure on industry to give us safe food. So as consumers, it's our responsibility to demand safe food because it's a contract. We are signing a contract with the manufacturers. Okay, is there any, I'll just open it to the, if anyone has got one question, I'll just allow one contribution from the audience as a comment. Yes, I see. Okay, is there anyone who wants to just take a go on a comment as we conclude?
Charles, can I just come in?
Yes.
Yes, Taku had responded here. I'm just reading his response. He says the slow uptake of HACCP is on part due to incompetence in people responsible for leading national food control infrastructure from Taku's perspective.
Okay, thank you. Okay, any other comments from the floor before I hand over to Kotsa to conclude?
Sorry, Charles, just a question.
Yes. Okay, maybe Charlotte can go first.
Can you hear me clearly?
Yes.
Okay, thank you, Charles, for all the presentations and for arranging this. I was quite intrigued with the first presentation, especially the issue of culture. And when we have to look at COVID-19 as presenting an opportunity for the food safety area as well. So I agree with the presenter. I just wanted to add another level because I thought he was focusing on business and food handlers. And there's a level of community which we really need to tap into, having learned from how community responded to COVID-19 and the messages of COVID-19. I think we can learn a lot from that when it comes to food safety aspects. So people are now very cognizant of their health and well-being. I think it's time for us to also raise awareness with our community members, use the same platforms like SMSs, adverts, and teach them about food safety. So if maybe we can just also look at the level of communities, in addition to business and people like food handlers, we can add individual communities as well. Thank you very much.
Thank you, Charlotte, for the comment. I think Isaac, I'll end with Isaac and then I will hand over to Kotza.
Thank you so much, Charles. It's Isaac from Australia here. My question is just a small one. I'd like to find out from Dr. Edson Kifamba the prices of the heifers that are going for buy one, get one free. Thank you.
Yes, Edson. Edson, can you hear us? I think we've got a bit of challenges with connectivity from Edson, but Isaac, I can assure you that we can arrange those prices. I'll communicate with you offline. I'll hook you up with Dr. Kifamba so that you can get 10. You can buy 10 and get 10 free.
10 free, yes. Okay, thank you so much.
Thank you. Without further ado, I think we have run out of our time. I'll just hand over to Kotza to say one or two words before we close.
Okay. Thank you, Charles. Let me start by thanking all our presenters for the insightful presentations, and also to thank our panelists for the valuable contributions. I also want to thank you, Charles, as our host, for steering this talk. Thank you also to our participants. We really enjoyed being with you. Thank you for joining us to this talk on World Food Safety talk today. I would just want to encourage everyone, let us keep the conversation going. Let us continue to talk about food safety. Even in those communities, we have a major role to play. Food safety is everybody's business, as we've been discussing. We all have a major role to play in this VUCA world. I just want also to emphasize that let us continue to move towards robust food safety management systems, and we need to deliberately build food safety culture. So when we are delivering food safety culture, it's not what you know, it's not what you do, but it's what you do. So it's not what you say, but what you do. Thank you, everyone. Thank you so much for joining us today. Let's continue to develop a food safety culture. Thank you. You can get our details in the last slide. We are going to send you more information. Please continue to interact with us. We look forward to interact with you. Thank you so much, everyone.
Thank you, Kotza. That brings to the end our event, and we want to thank the FAO who actually collaborated with us on this event and put us on their website. We have a report that we need to send to FAO, and we will communicate back to them on this very successful event. Thank you, everyone, and goodbye. I think we probably need to take a picture for the FAO. You can wave as we go out and maybe write some comments. so that we can give FAO some feedback on how this event has been very successful. There have been 92, at the tops, there were 92 participants. 92 participants at tops, so that was excellent. Thank you, guys.
Bye-bye.
Bye.
Bye-bye.
Bye-bye.
Bye. Thank you for the wonderful presentation. Thank you.
Thank you, guys.
Thank you. Bye.
Bye-bye. Thank you.
Thank you, Afoloke.
Thank you.
Cheers.
Bye.
Thank you.
Bye-bye.
Brilliant
Justice here.
to meet you. Let's continue to talk on emails.
Thank you. Thank you.
Thank you, Charles, for certainly do very, very insightful. We shall keep that.
Oh, perfect. Perfect. Thank you. Let's continue to talk on emails. Thank you, Tith. I saw your comments. We will send the presentations. Tith.
Well, very much appreciated. God bless you. Thank you, sir.
Thank you.
Thank you.